Welcome back to the Dentist News Network. I'm Scott Drake. This is part 2 in a series of videos on patients who suffer from chronic headaches and migraines. Today, my guests are Dr. Joe Harris from Harris Dental in Phoenix, Arizona. Dr. Harris, welcome back.
Thank you, Scott.
And also Dr. Rick Amy from Truedenta. Rick, thank you.
Good to be back. Thank you.
All right, let's talk about some of the new treatments for chronic headaches and migraines.
Okay. Well, when we understand where almost all headaches come from, again, the trigeminal cervical nucleus in the brainstem, and the trigeminal nerve is predominantly the dental nerve, and that's the one that controls the chewing and how your teeth stim together and all this feedback. When we understand that the chewing and the swallowing happens 2,000 times a day, and the temporomandibular joint sends more information into brain than any other joint in the body, it's really important for us to understand and to balance that component. Now there's another component because again it's shared trigeminal cervical or the neck, and the upper neck has to work in harmony with these muscles as well. So we do a couple different things to differentially diagnose to see how in balance or out of balance those are. Again, this is from the American Medical Association's looking at pain and disability, which really looks at objective findings. Now, objective means that it's quantifiable, we can actually measure it. The problem with pain in a lot of our patients is that pain is individual and it's hard to really measure. So the important things is we're going to use a digital force analysis, which is a sensor that has thousands and thousands of little springs on them that actually can measure the way your muscles move when you go up and down, what direction they go. It'll also measure the balance from one side in relationship to the other, and it'll measure the force on each grouping of teeth together. And when we see some red flags there, we know that that is part of the problem and that we're going to have to balance that. We're also going to have to balance how the muscles move that joint, and many times our patients have no idea how sore those muscles are until we get in there and we actually palpate them and feel them, and they can rate those for us. Then in order to figure out if there's a disability in the cervical spine, we take a computer and we actually put it in with what they call dual inclinometers, or just measurements that actually can measure your movement of flexion and extension, lateral flexion and rotation, and this will give us a computerized analysis of what or how far you're disabled. So those are the two main things that we really look at that can objectively figure out if there's a problem both from the dental aspect and that upper cervical spine aspect.
Rick, can you now talk about treatment modality in these cases?
Okay. When we look at this area of what we're calling the dental nerve dysfunction that we're talking about, it's sort of like we look at a bucket. And you can put your stressors in here and your traumas and your car accidents and your horse falls and all these wonderful things. And then after a while, that bucket gets full. And then we start to have some stress, or we have these triggers, what we talk about, and that spills over. And now we have the headaches, the migraines, and the pain, and those wonderful things. What we have to do is we have to get the muscles under control. We have to get them to relax, and that's really our first goal. So we know that trauma is almost always involved, whether it's micro trauma such as clenching and grinding, which is about 75 to 80% of our women population now report that they clench and grind on a daily basis, or whether it was a motor vehicle accident, a sports injury, a fall, or some other major traumas. This usually leads to some type of scar tissue. So we have to break up the scar tissue and to get the movement better and the balance back in. So we're going to break up scar tissue, we're going to use different modalities to heal the muscles and get them to relax, and then we're going to help the tissues to heal fast. Once we have that muscles in balance, then the dentistry can begin.
And Dr. Harris, finally, talk about how dentistry plays a part in the treatment.
Once the muscles are relaxed, that allows the joint to be in the right position and get things back to where it was all intended to be. And at that point, we can discover if there are dental issues. And when I'm saying dental there's a lot involved in dentistry, but hard tissue things like our teeth can get out of position for a lot of reasons. They can be ground out of position by bruxing and grinding. They can be crowded and crooked teeth that came in the wrong way. They can be teeth that were put in to a position by orthodontics that maybe wasn't the most perfect position. Orthodontics is actually one of the causes, one of the strong contributing factors to these migraines. So once we've got everything calmed down, we can then go back and identify if there are discrepancies now, maybe a crown that was put in that it wasn't quite right, and very selectively and specifically and conservatively make the necessary adjustments to the bite, to the way the teeth fit together, and take away one of those stressors or one of those things that would trigger future problems down the road.
Yeah, many times we see those I sort of use the analogy is that these force imbalances are sort of like a pebble, but instead of your shoe in your mouth. And when those things are out of balance, then your muscles have to shift. Just like if you're trying to walk, your muscles are going to shift to always get away from pain. And then this is where we need to really correct those particular things. And once we do that, it really stabilizes the area. And guess what? That bucket just starts going down and down, and people get better. Their headaches get better, their migraines start to go away, and so does their pain.
My guests have been Dr. Joe Harris from Harris Dental in Phoenix, Arizona, and Dr. Rick Amy from Truedenta. I'm Scott Drake. You're watching the Dentist News Network.